Hey everyone, we're going to cover my 6 favorite exercises for tennis elbow. Hey, I'm Sebastian at Performance Play Sports Care, part of the locally world famous chiropractors in Costa Mesa, California. This is going to be a follow along video. There's going to be a countdown timer that starts in the corner. Usually when we suggest this to our clients at Performance Place, we have them do it every single day for a month. And a lot of times during that period of time, people will advance past these exercises and we need to develop something a little bit more customized for them. The area that we're talking about here is outer elbow pain right into this region here. It feels like it's right on the bone, but it's a little bit down. And a lot of times it will increase with things like opening jars, opening doors, gripping tennis rackets, pickleball rackets. Even stuff like this nature will tend to bother it, or wrist movement upward. At the very end of this video, we're going to cover a little bit of anatomy and mechanics of tennis elbow to give you some ideas of why this may be happening with you. But for those of you who want the exercises, we're going to cover them right now. The first one is pretty simple. It's self-myofascial release of the area around the elbow. Now, a nice way to do it is just take your fingertips and start to roll into some of the sensitive regions. I wouldn't macerate the area. It's not like you're trying to make a dinner and macerate the meat. You're just trying to flick a little bit here and there. If you find an area that's a little bit more sensitive, you can back off a little bit more and stay on that region and just rub it side to side, other direction, almost like you're making a little bit of a star pattern until the sensitivity decreases. Now you may find that there's sensitivity all the way down into part of the forearm here, but you may find it up into this region as well, above the elbow. Most people will tend to find it right around the point of the elbow and a little bit more down. It's important to note too, if you have numbness and tingling with this problem, this is probably not tennis elbow. In that case, you're going to want to click on some of the videos at the end of this to learn a little bit more too. The second one is going to be skin rolling. We're going to grab the skin almost as if it's like my shirt. Grab the skin and make waves through the skin. Okay, we're just going to cover the region. For a lot of people, this is pretty darn sensitive, all right? It's okay to be sensitive into the region. I've never met anyone who hurt themselves with skin rolling, unless you're on blood thinners. In that case, you didn't hurt yourself, you're going to bruise yourself, so maybe don't do that on this video. And we're just going to cover up and down on the region. By the way, back on the area of having numbness tingling into the fingers, a lot of times that's more of a nerve-based complaint. We do have some great resources on it. I'm going to link in the description at the bottom of the video. A lot of times that's more from neck, shoulder types of conditions, although it can present as tennis elbow. The numbness tingling is a little bit more exclusive to a nerve-based problem. Okay, skin rolling, done. Now we're going to do flicking, all right? You're going to place your elbow right on your hand, and you're going to flick. If any of you have seen, I don't know if it's still around on Instagram, there was the Salt Bay. So he just flicked the salt on there, but he'd do it from high. So now we're going to do it low. We're going to flick the salt directly on the meat at the bottom, okay? You don't have to go as fast as me, but extending your elbow a lot of times is not painful for people with tennis elbow. It's just a little bit stiff, if you will. If it's stiff to flick down, you can flick up, like so. And then start to explore the flick down just a little bit. All right. Ideally, what we want to do with a tennis elbow is we want to expose it to some passive range of motion first, and then some active range of motion, but then at some point we have to load it. We're not going to cover loading in this exercise video today, but it is something you're going to want to do very soon. Okay. Next one is we're going to stretch actually the opposing group of muscles here. This is going to be a wrist flexor stretch. I know it's going to seem like, well, why are we stretching the wrist flexors when we have a problem with the wrist extensors? Well, it's easiest just to start on the opposite side, and a lot of times, surprisingly, stretching the flexor group really helps out with decreasing sensitivity, even to touch, of the outer part of the elbow. So we're going to do this area first, and then in the next go through, we're going to do the opposite side. If you feel like you can't get this full range of the wrist or the elbow, that's okay. Just do the part that you can. Some people can only get here. That's okay too. Just go as far as you can. We're just trying to create a little bit of stretch into this region of the forearm. You might feel a little bit into the fingers. That's all completely normal. By the way, it's important to note none of this should make you feel worse after you're done. If it is, this is not the right program for you. Okay, now we're going to do the backside that everyone has probably been waiting for. We're going to take this almost like you're a snake. You're going to do a little bit of a snake strike here. Now, some people have been taught to do this on the side of their body. You can do that. It's just whatever's most comfortable to you. And as you get more comfortable with it, you can make it faster. Okay? But in the beginning, you might want to do just some gentle oscillating ones just to feel things out. With people normally, when they don't have tennis elbow, they'll feel it more into here. When you have tennis elbow, or you might feel it more into that region right at the point as well too. So just be sensitive to it. Rome wasn't built in a day. You don't need to blow through these things. Again, you're going to come through this series for about a month anyways. So just make sure that you're just doing a little bit every time. Now the last one we're going to do is going to be wrist rolls. All right. I encourage you to hold your wrist right into here, and you're just going to be drawing a big old circle, or as if you had a sparkler in your hand, you're going to be trying to draw the biggest circle that you possibly can. Again, it's the biggest circle that you can, not the biggest circle that I can. And so just do whatever you can. If you feel like you want to do it without holding this too, you can, but just make sure that when you do that, it's not that you're not moving the elbow. So people tend to get sloppy and they tend to move the elbow a little bit. I just want you to move the wrist really. The important part of this is that, again, with the anatomy of tennis elbow, people forget to realize that the muscles that go down from that point actually go all the way to the fingers and to the wrist. And so these muscles need to be worked from the entire range, and just doing elbow movement isn't going to cut it most of the time. There we go. So again, this is that follow along series. I want you to come back to this every single day for a month and just see how things go for you. If you're looking for something more specifically designed for you, we can offer that. We see people in person and virtually, and as you can see by this video, we coach people through video all the time, and it's really not a problem. So if you'd like something, just reach out to us. Our contact information is below. Now, for those of you who are interested a little bit more about the anatomy of the tennis elbow, we're going to go into that section right now. Now, for the anatomy and a little bit of biomechanics of the elbow, it's important to move your way up onto the shoulder. The shoulder and elbow work together, especially with things like tennis, racket sports, and pickleball, and so on. Although the elbow is taking the hit, the problem may be actually at the shoulder. The local anatomy of the elbow is really nice and easy to see if you just take your wrist and you flex your palm here. That's a fist actually. You're flexing your fist. And so you can see the musculature as it starts to go up in that region right into there, okay? And this is the area that bothers most people. Surprisingly, actually, if you take your fingers and you cover that, right? So there's the spot, you cover it right below it and you kind of grab there. If you grip again, most of the time people that with tennis elbow won't have any pain anymore. And that's why things like wrist wrap or elbow wraps will work really well, or you can do pre-roll and roll it up into a light band. And this essentially forces the contraction to be broadened, and it doesn't get as much to this region here. And so this is a really easy way to manage it, but you can see how gripping and the muscles that go up into that location there can be irritated, but why they irritated is the big picture. We tend to perform something called an SFMA. SFMA is a movement exam to figure out what other areas are possible contributing factors to your problem versus just only the elbow, because it's not always just the elbow's problem. The body works as one big unit, and so the shoulder blade, the mid-back are all big parts of the puzzle. The easiest one that you can probably test on your own is a kind of a sunblock test, if you will. And so we're going to go here and reach behind as far as you can without crawling and cheating. You just go up and lay, and you go up and lay. And as you can probably see on my right shoulder, I'm limited in range of motion a little bit. Over top, here and here, I'm probably about the same. And so many of you will find that the shoulder is limited in range of motion, which puts extra demand on the elbow. And one way you can make this area actually decrease workload is to share the movement up at the shoulder. One way to do that is shoulder extension exercises. This is one easy way. I call them yo-hos. And so we're just going to go like this, almost like you're a yo-ho, yo-ho, you know, you're pulling back, okay? And so if you're not gripping anything really, it doesn't usually bother the elbow, but we're driving the shoulder into extension. And sometimes this can help out immediately with stretching the capsule of the shoulder, stretching the muscles of the shoulder, which help out with increase in range of the shoulder, which decreases workload on the elbow and the elbow muscles. And so let's just see if there's any change here. I see that it's still limited on the right, but I can feel that I can actually touch the tip of my elbow or my shoulder blade now. Yo-hos, you can go slow, or you can have someone help you and do overpressure too. And so this is the strategy we like to use at Performance Place, is kind of looking around the rest of the body, and especially in the immediate region, and figure out what else is not working, but it's not painful. And that's the trick, that people's shoulder doesn't usually bother them. It's just a contributing part, and it's the reason why this thing keeps coming back. Even after you reduce the sensitivity and the pain and you go through rehabilitation, it comes back after you start playing a bit again. So you may need to look elsewhere, into the shoulder or even into the wrists, the core, the shoulder blade, or even in the mid-back. So all these are very important parts. As I mentioned earlier, the numbness and tingling aspect of it, there may be a nerve aspect of it too. The radial nerve passes right by the lateral epicondyle of the elbow. It can simulate something like tennis elbow. All these things are treatable, but a treatment of one is not the same as the treatment of another. But most of them do require some type of exercise, stretching, and coaching typically. If you guys are looking for help on how to program something for yourself, we can help you. Again, at Performance Place, we see virtual and in person, and I think we're very good at good job of seeing people virtually. So click on this video, subscribe to the channel, and we have other videos at the end here which can help you out with finding out more about tennis elbow. We'll see you guys next time.